Hey, everybody. Welcome back to the Health Matters podcast. I'm Saul Marquez, hosting today's episode straight from Health at the Las Vegas Convention Center. Today, I have the privilege of hosting two outstanding leaders in healthcare. Jason Sherwin leads healthcare business development at Clear, where he focuses on how Clear's single interoperable identity platform can deliver value to health systems, payers, digital health, and more. We also have Ryan Howells with us today. He is a principal at Leavitt Partners based out of Washington, D.C. Ryan works with the White House, Congress, HHS, and VHA on healthcare policy and interoperability issues. We're excited to have both of them here today to talk about the partnership and the work that they're doing with interoperability. Welcome to the podcast, Jason and Ryan.
Thanks, Saul.
Thanks for having us.
It's a true pleasure to have you guys here. And look, identity is key. So Jason, why don't we kick it off with you? Why is identity so important in healthcare, and what role does Clear play?
First of all, Clear is obsessed with empowering safer and easier experiences for consumers. We've done that for over 13 years in the airport, and we build an incredible brand and something that stands for privacy and trust for our consumers. And so when you think about the airport, it's a zero-fail environment. Can't get identity wrong. And healthcare is very similar, if not a higher threshold, a higher bar for that. You don't want to misidentify a patient. For us, the extension was very natural, right? We have 17 million consumers on our platform. And what we've built is this consumer-facing identity, right? Where you are always you, and you can use your identity, like a selfie, for example, to prove who you say you are in that moment and ultimately power safer and easier experiences. So when you think about healthcare, in healthcare, we spend over $1 trillion per year, $1 trillion on administrative costs. And much of that cost, when you think about it, is verifying that the patient in front of you, for example, is who they say they are. Whether that's creating a patient portal account, for example, resetting a password, verifying who you are when you're scheduling an appointment with a call center where you spend on average a minute or two to prove you are who you say you are, checking in, whether in a hospital lobby or the clinic. When you think about all these experiences, what Clear can ultimately do is replace the clipboard. You verify who you are. It's that concept of identity and then consent, right? Consenting to share, for example, that name, date of birth, and phone number to make it easier for you to create an account to access your healthcare information, which we're incredibly excited about with everything happening with the CARES Act and the individual access rule. And so it's really about combining that concept of safer and easier experiences with that health identity and making that simpler. And we can talk more about some of the specific use cases in terms of how we're deploying it.
It's fascinating, and I've been on both sides, and I'm sure everybody listening has been on both sides of a bad experience and a good experience. The Clear platform has certainly made my life easier at the airports, and fascinating to think about it playing a role in healthcare. Ryan, tell us about the CARIN Alliance and why it's so important. What role does identity play, and what are you doing to empower patients with access to their data, as Jason was describing?
Sure, Saul. Great to be here. So the CARIN Alliance was formed by former Secretary Mike Leavitt, Anish Chopra, I was going to call him governor, which sometimes you actually need to do, David Brailer, David Blumenthal, and about 80 organizations that are focused on getting consumers digital access to their healthcare data. And when we started, we said we envision a world where individuals can access their health information where, when, and how they want from any payer or provider in the country without talking to anybody. That was the key. Now, today you have portal access where if you go to the same provider all the time, you can get access to your health information. But you can't aggregate that data across different, because we don't have a good ability to be able to aggregate health information across different entities in the healthcare system. 21st Century Cures Act enabled the use of FHIR APIs across the healthcare ecosystem for both CMS payers and providers. But it didn't tie together that data using an identity that you choose, you create, and you make portable across the ecosystem. Think of it like a single sign-on for healthcare. So when I go through the airport now, I have a single sign-on to actually get through the airport, right?
Yeah.
I use Clear. I have an opportunity to be able to go through that process and streamline my way through the airport line, which I'm very grateful for.
Yeah, for sure.
I want to streamline my way through healthcare. I want to figure out a way where I can choose to be able to create a Clear account and a Clear identity, I should say, and that identity can be used across different entities. So when we started, like I said, and then when we looked at identity, we actually said back in 2017 that everyone needs one of these credentials, these identity proof credentials. For the nerds out there, it's called a NIST IL2 credential. And we said, That's one of the things we need across all of healthcare because we could have a single sign-on. Once we actually get that enabled and find ways where each individual consumer can have their own, then we can have a single sign-on for healthcare and they can pull their data into an app of their choice using these FHIR APIs. That's what Clear is enabling, which is really exciting. And now we've got an opportunity to link it all together. We have this thing called the Trusted Exchange Framework and Common Agreement that ONC has developed. We have the CMS interoperability rules. All of that is going to be enabled by this ability for us to have this single sign-on for healthcare using Clear and some of the other entities that are out there to be able to aggregate that health information, make that happen at scale.
Well, it's fascinating. It sounds like now is the time. We've got the infrastructure, the policy, the tech, and the vision to put it all together to give us what we deserve in healthcare, a more seamless experience. And it's really exciting. Can you give us a practical example of an initiative where consumer access to healthcare data is being unlocked?
Yeah, sure. So just recently, actually, the end of last year, the governor for the state of Utah, Governor Spencer Cox, actually came to us and said, we really want to be able to empower all of our citizens to be able to access the tools and services that they need, and as well as the data that they need to be healthier and happier. That includes both data on the public sector side, so whether it's Medicaid, any of the state-specific benefits that are associated with that, or whether it's healthcare data on the private sector. And what has happened is we, under his direction, have actually major payers and providers in the state of Utah to be able to implement the largest FHIR API pilot in the country right now.
Wow.
And that is all going to be empowered not only by the FHIR APIs that are out there, but also by these digital identity solutions like Clear. And as a result of that, the opportunities here are significant because now a citizen in the state of Utah, beginning next year, is going to have the opportunity where they can actually take their health information and be able to take, I should say, their identity and use it for multiple different endpoints, right? Whether that's public endpoints on the Medicaid side for state-specific benefits, or whether that's on the private sector side, whether that's through my payer or my provider. And all of that is going to be enabled by this infrastructure, both the digital identity infrastructure as well as the FHIR API infrastructure that's going to be able to take place. That becomes a hopeful model for how we could actually do this at scale around the country. And that's what we're really excited about.
That's very exciting, Ryan. Thank you for that. And I just have to ask you, how does it feel? Because I remember talking to you about these things 5 years ago.
Is it awesome? It's great.
And now it's happening.
It takes a long time, Saul. It takes a long time. But all of the things that we talked about 5 years ago is all coming to pass.
So great.
But it just takes a while. And when you stay at it, and you have great partners like Clear and others that are really dedicated and devoted to making this happen, it becomes almost a self-fulfilling prophecy as all of these great entities, both public and private, work together to actually make this a reality.
That's great.
It's all about putting consumers in control, right? So when we think about it, the healthcare system, it's always been like the hospital's data, right? They own, quote unquote, that data. And this is an opportunity to put consumers in control. It's their information, make it easier for them to share it, whether it's with their provider, their family member or loved one who may be managing their care. That's ultimately what this is all about.
And Jason, so really a little bit more on the Clear side, what inspired the move into healthcare? I'm just curious about, it makes so much sense. I didn't think about it going through the lines at the airport. What inspired it?
I would say, look, going back to our obsession with safer and easier experiences, I think a few things. One is we were building a healthcare business before COVID, but COVID was really a unique moment where the world shut down. And what we saw was that identity tied to your health credentials was really powerful. And for example, taking a selfie in our app and then being able to link your vaccine information. In fact, to get to this very event at Health, we powered this back in, I think it was 2021 and again in 2022, making it really simple for consumers to share that healthcare information privately and securely with Clear. And I think Health Pass proved, right, that consumers trust Clear with that sensitive healthcare information. And so I think that gave us the impetus to really double down in care. And what we recognize is that the data across the industry is so siloed, right? As we've built electronic medical records and other platforms over the past decade or so, the data is all there. And what we see is that we can actually help consumers and providers connect to that data and ultimately drive better experiences and reduce costs to the system at the same time.
That's awesome. And yeah, I do remember that use case going to, I think it was like the American Society of Anesthesiologists meeting. And I remember the Clear. I'm like, oh my God, Clear's there. And it makes sense. It was a jumping off point, and here we are. Folks, super exciting stuff happening in healthcare today with partnerships like Jason and Ryan, Leavitt Partners, and Clear. It's an exciting time. For all the listeners out there, Jason, Ryan, what call to action would you give them?
So what I would say is, if I'm a provider right now, unfortunately, I am suffering a lot from a revenue perspective, right? And it is really hard. I don't want another point solution. I don't want anything that is actually going to be more burdensome for our team. I want something that's real practical and I can use today. So here's the use case, right? Let's take, right now I'm paying for a revenue cycle management vendor because 30% of the people that walk through my door don't have a digital insurance card. I'm paying for a patient matching solution, right? Because I'm trying to match kind of garbage with garbage, right? I don't know what's your current address or demographic information. I'm paying for a data aggregation vendor. What if we just be able to aim in terms of what that looks like? What if I, as an individual patient, before I actually go see you as a doctor, could then be able to say, I'm going to create my digital identity in Clear. That is now the source of truth. Now my patient matching issues really go away over time to make that happen. Then I'm going to aggregate my own data through an app of my choice to be able to make that happen. And then I'm going to be able to use a digital insurance card, the CARIN IG for digital insurance card, and find a way where that can be able to my provider before you look in the door. How much value is that going to be and less of a burden for providers? All of that technology is available today. We don't have to wait for Congress. We don't have to wait. We can actually do that today, and it reduced the burden on the front staff significantly. And so that's the kind of the use case of call to action. If I'm a provider, if I'm a payer, I bought a lot of companies recently, right? And I'm trying to integrate them. And the only constant that I have is the person themselves, whether it's a pharmacy or a provider or a health plan or a PBM, whatever I have, I've got all of these entities. I've got to tie them together with something. Clear can help do that. And again, other entities can as well, but these person-centric technologies that the CARIN Alliance and others are helping to be able to promote and find ways where other people can use them, that's going to tie all of this together, whether they decide to do virtual care or in-person care or inpatient care. Doesn't even make a difference. All of that can be tied together with these consumer-directed technologies.
Thanks for that. Thanks for that, Ryan. Yeah,
just
Jason.
To build on that, I think everything Ryan described is 100% correct, and I feel like I should hire Ryan. But from a practical perspective, right, it's a crawl, walk, run. And so where we typically start with partners, as Ryan was speaking to, the tremendous cost pressure that the healthcare system's under today is that we can actually, for example, significantly reduce the volume of call center calls because we can automate simple use cases like the creation of a patient portal account or resetting your password or verifying who you are in that moment when you're asking a billing question or you want to access your lab results over the phone. What that does is it gets that consumer onboarded onto the platform. We have what we call our link ID that's connected to Jason and his relationship with health system ABC. And then what is amazing about that is now that identity, you've proven that identity at the front door. So you've eliminated the need to fix it on the back end, that 8 to 10% patient duplicate average across the industry. And now you can start to streamline even more experiences. Now when Jason shows up in the clinic, for example, and wants to check in for a visit, he just sees that same person, right? So to Ryan's point, eliminating a lot of those various technologies that are powering these ecosystems and ultimately simplifying it through Clear.
That's certainly exciting. And the work that's been done over the many years is now coming to fruition. Utah being an example, all the use cases that you guys offered. If you guys are listening to this and you're thinking we could do better, the answer is yes. In the show notes, we'll leave ways to get in touch with Jason and Ryan and their respective companies, and for them to know, where can they reach out to you and your organizations?
So you can reach us. That's a good question. We have a couple of places. You can go to clearme.com/healthcare. And then we also have an email distribution, healthcare@clearme.com. And we'd be happy to chat and get in touch with you. Also available on LinkedIn and all those great platforms as well.
Outstanding.
CARIN Alliance, CARIN, CARINalliance.com, as well as be able to LinkedIn as well. We'd love to be able to connect with you.
Amazing. There you have it, folks. Reach out to them. The ways to get in touch are in the show notes. Jason, Ryan, thank you guys for doing this today.
Thank you.
Thanks so much.